We're going to talk about Chapter 9, Maternal and Fetal Nutrition. When you think about nutrition, we think of that just as an assessment as we would do a physical assessment on a patient. We need to assess the patient's overall status. We need to know if she's underweight, normal weight, or overweight. It's a very important key when we talk about education and teaching for this patient during her pregnancy. Some of the other key components are we actually want to make sure that there is no diagnosis of nutritional problems or any risk factors. We want to know if this patient has a history of being an anorexic patient or a bulimic patient or a diabetic patient. We also want to know what's going to work best for our patient. This is an individualized dietary goal. Not everybody is going to be the same exact height, weight, and need the same requirements. So we need to make it very individual specific. And if we need to, we can also refer our patient to a nutritionist or a dietitian. One thing we need to know, and we talked a little bit about in the other chapters, and when we talked about, remember, in terms of first trimester, second, and third, first trimester is very crucial in organ development. That is very important for moms to get in as much folic acid or folate in their diet as possible. They don't have to just eat it in their diet. They can take tablets. A lot of times moms who are trying to get pregnant will take prenatal vitamins and supplements and folic acid prior to getting pregnant because it's so detrimental, that folic acid, in order to close the neural tube and form the spinal cord. That is really important. The other thing you need to know is when we're talking about the proper closure and then formation of the spinal cord, this usually occurs within the first month of gestation. The first month of gestation is a very short little window, and this is usually the window that most moms don't know that they're pregnant. The chart you're looking at is from your textbook. These are some factors that influence the outcome of pregnancy. We know education, knowledge, skills, comprehension, language, prenatal education. The more moms are educated and educated correctly, the better their pregnancy is going to be as far as trying to optimize the health for mom and for baby. And that is the goal. We want both of them to have a very healthy pregnancy and delivery. Nutrition factors play an influence. Culture, genetics play an influence. There are several different things on this chart, which I do like this chart. It's a really simple, cute breakdown of just some of those factors that play an important key role. Just so that you note, there is a table on page 229 and 230 in your textbook. It's table 9-1. This is not a table that I want you guys to become obsessed with studying. It has some great just information, but I'm not going to test you on, and more than likely boards is not going to test you on, the exact number of milligrams of calcium and iron and so on that you need. The biggest important thing from this chapter is you're going to need to know the sources in order to obtain those vitamins. So what's the best source, or what are sources of getting iron in? What are sources of getting the calcium in? Those are the questions that they like to ask you on boards. And it's not going to be your straightforward, oh, calcium is milk. It's not going to be like that. They're usually more tricky than that. So that's where I want you to spend some time. What are the sources to get these nutrients into this mom? Because this is what you're going to educate her on. The other big thing that plays an important factor in terms of nutrition for mother-baby is BMI. We need to know that for a mom who has a normal BMI, she's can only gain, or should only gain, 11.5 to 16 kilograms. That equivalents to 25 to 35 pounds. And this is for normal. This is a normal BMI. also, you would need to know, what is a normal BMI range? What if I have a patient who's underweight? How much does she need versus if I have a patient who's overweight? We also need to know energy needs, pattern of weight gain, restricting, and excess weight gain, because it is important. Because if we have moms who have not enough weight and they're underweight, that can cause problems. We end up with preterm labor and low birth weight babies, or something called IUGR. You're going to hear me talk about IUGR throughout the different chapters. It's intrauterine growth restriction. So that means we have a baby, but the baby doesn't grow as the baby should. So if we have a 40-week baby, mom delivers, and she delivers a baby who's only about 5 pounds, and mom was a normal weight, and everything looked okay, that's an IUGR baby. They're a little disproportioned to, their head's a little disproportioned for their body, so they may have a little bit bigger head than their body. So that term you will hear throughout as we move forward through the chapters. The other thing is, if you have a mom who is overweight, it could be multiple gestations, so we could have more than one baby in there. Mom could have edema, hypertension. She could just be overeating, and she could be obese to begin with. This will lead to complications with baby and delivery. You'll have a baby who is macrosomia. This is another term that you are going to hear a lot and see a lot in the mother-baby world. Typically, moms who are diabetic will have macrosomia babies. This means they're large, extra large. Those are those cute little fat cheek, squishy, puffy thigh babies. The only problem is sometimes they end up with more problems than if you have a little teeny baby. The other things that can happen is mom may end up with a C-section. Postpartum hemorrhage risk is higher. She's at higher risk for wound and infection because they may have to cut her in order to get baby out, and birth trauma. So those are some things that can happen if we have an underweight patient or an overweight patient versus a normal weight patient. So when we talk in terms of nutritional needs, one of the things moms should be educated on is to actually decrease the amount of caffeine that they're taking in. They really should have no caffeine, but you can't expect a mom who drinks 2 sodas a day, 2 cups of coffee a day, or more to just completely cut it out, because they're going to have a little bit of withdrawal symptoms and probably have that caffeine headache, especially if they drink a lot of caffeine. So it may be a matter of compromising. Let's say if you do drink 4 sodas a day, let's take that to only 2, and then hopefully maybe wean it down to completely none. The other thing is, we want moms to increase their fluid intake. We want them to take water and drink lots of water, because not only is that going to help with fluid and electrolyte balance and prevent mom from being dehydrated, because in the first trimester, most moms are having nausea and vomiting. So we need them to stay hydrated. And the other thing it does is a lot of these moms end up with constipation, so that fluid's going to help with that issue of constipation. So now when we're talking about iron and calcium, so you have some of your minerals and vitamins, everything that's really important. One of the things that comes out to give you a lot of iron in your diet are prunes. Prunes, let me tell you, are not something everybody likes to eat. I've had patients who think they're candy, other ones who want to drink it nice and warm, and others who think it's disgusting. But prunes have a lot of iron in them. So this is one of those cases where I said it's not going to be those Captain Obvious type questions on your state boards about where can I get the most nutrients for this particular vitamin. Calcium is another one that we think of that's really important, and sardines will give you calcium. Some of your other minerals and electrolytes, you guys can see those there, and you can review them in your textbook. This is just a continuation of minerals and vitamins. One of the things that we're going to look at on this particular slide is B12. B12 is important for your formation of your red blood cells and neural function. So it is all these minerals and vitamins are very important, and they each have a purpose. We talked about folic acid already, about neural tube defects. It's really important to have that on board. When we talk about terms of adolescence and pregnancy needs and nutrition is extremely important. You have to think about an adolescent. If we have someone who's between 15 and 18, they don't have the greatest diet. They're young, they have great metabolism, so they don't really have to eat the greatest diet. They can eat all the junk and still pretty much stay kind of thin. So they don't have the nutritional needs or maybe the education yet on the importance of all of these nutrients and vitamins that they should have while they're pregnant. The other big thing is a lot of times adolescents do not get prenatal care, and it is so important to educate them on the importance of getting prenatal care and follow-up during their pregnancy. Sometimes it's financial issues that are barriers. Sometimes it's home, social, economic things that are barriers in order for them not to get prenatal care. So we really want to promote and teach and educate adolescents on nutrition. This particular slide just kind of does a little blurb about preeclampsia. Those of you who did the simulation over the summer with preeclampsia, we'll talk way more about preeclampsia as we get into complications for pregnancy. This just says that there's no cause for preeclampsia. Somewhere along the line, some kind of research must have sprouted up and said that nutrition played a key into preeclampsia, but for the most part, nutrition is not a big factor in causing a woman to be preeclamptic. When we talk about nutrition, we're not only talking about prenatal needs, pregnancy needs, we also talk about postpartum needs and lactation. It is extremely important if mom is going to breastfeed that she increases her energy intake and calories. She should increase this to 330 calories a day in the first 6 months at least, because we have a baby who is looking at mom for nutrition and burning up those calories that mom is putting in, so she needs to take on the extra calories. She needs all the extra vitamins and nutrients. The other thing we want to encourage mom to do is continue to increase her fluid intake. That helps stimulate milk production. We still want her to restrict alcohol, caffeine, certain medications, because those are excreted through the milk. So whatever mom is taking in, baby's also getting. A lot of times there's also certain foods. If a baby's having a lot of trouble with their stomach, they're really gassy, they're really fussy, mom may be eating maybe a lot of spicy foods, and that's transferring over to baby, and baby's stomach is not really able to digest and process that, break it down quite like we are. So sometimes it's a matter of just modifying that diet too. So we talked a little bit in the beginning about one of the really important things when you're assessing, if you're in the clinic and you're assessing this mom who's pregnant, is her dietary history. And you're not just including, nutritional habits. It's a physical exam. We're doing the anthropometric measurements. We're also doing lab testing. We want to know what her baseline labs are, her H&H, her red blood cells. So those play an important key too. So the last thing when we talk about collaborating care as far as nutritional needs go, there are also some things that play into a factor. These moms usually, like I said, in the first trimester have nausea and vomiting. They're very limited on medications and things that they can take, but we want to make sure that they stay hydrated. It might be We have to teach them, maybe a bland diet in the very beginning, crackers, toast, something very simple to keep on their stomach, but in order to keep it down. Constipation is a big key. Pyrosis, you will see that term a lot. It's one of those, remember we talked about Mother Baby's termy. Pyrosis just means heartburn. So if you see that term, it's heartburn. Cultural influences, and then we also have patients who are vegetarian, vegan, strict vegan, or vegetarian. Those also play an important role. They're not going to be maybe getting quite as much protein, but we need to find other sources, good sources of protein for them, and what can we do to help them out to maintain their healthy diet and get all those minerals and vitamins in for mom and for baby. So this finishes up our chapter on nutrition, which is chapter 9.